Hello, and welcome to the Mother Birth Podcast, where we navigate the terrains of women's health and maternal well-being through the lens of yoga therapy and Ayurveda. I am Leanne Matullo, and I'm a perinatal yoga therapist, a doula, writer, creative entrepreneur, teacher, and mother. I'll be your guide as we excavate the mysteries of conscious conception, pregnancy, birth, postpartum, mothering in all its forms, and matters of the feminine. I'm so glad that you're here. Hello, welcome back to Mother Birth. I'm Leanne. I am so excited once again that you're here. Maybe it's your first time listening. Maybe this is your fifth time. Who knows? Who knows? But wherever you are in this journey, I am grateful for you. I'm grateful to be a voice in your ears. And I was kind of just laughing to myself just a few moments ago because my husband actually edits the videos and the audio for the podcasting world and for the YouTube world. And I take a few moments to get into the flow because I want you to know this. I'm praying that whatever needs to be said is said and shared. And it's one of the reasons why I just like to free flow. This time I actually have a few notes because I don't want to miss pieces of our conversation. And there's so many more directions and so much more to say about today's topic. But I typically actually pray and then call upon the energies of a goddess, a Hindu, also a tantric goddess, Saraswati. And I have if you're on YouTube, you can see my altar behind me. You can't see her, but there's a really tiny form of Saraswati. And she is the goddess of speech and language and creativity and music and literature, so many things. And it's not that we necessarily pray or worship these forms of the goddess, it's that we actually allow these energies to come forth in ourselves. And I don't know why I felt the need to share that, but I do. And it's something, again, that I teach about is how to work with the feminine energies. And so often these goddess archetypes help us to see the different forms of those energies. And today I'm working with Saraswati. So yeah, that's that. Today I want to talk to you about things that you can decline in pregnancy, during your pregnancy, and also perhaps things to think about during your birth or after your birth, rather, right? The moment where your baby is born. This is not exhaustive because we could be here for a really long time talking about some of these things. But I got the idea because I was on the beach recently. So we live near the ocean in Rhode Island and we go pretty much every weekend. Now it's getting to be the later days of summer. It's early fall, just for context for those who might be listening in the future. But I was on the beach recently with some friends, and one of my friend's sisters is pregnant. Always very exciting. And I'm not going to share her story if she might be listening or her friend is listening. But one of the things I asked was, who's going to say the gender of the baby? Because they're waiting to find out the gender. And which is also super exciting. And she had said, oh my gosh, we haven't talked about that. And like, that's such a great idea. I was like, yeah, like you get to decide, right? Like when your baby is born, like you can say, I want to say the gender, or I want my partner or my husband or my wife to say the gender. And it just gave me this idea to talk about some of the things that we don't know, that we can say no to, that we can say yes to, that we can question. So often during our prenatal journeys, even our fertility journeys, if we're having some fertility challenges, we do what the people in white coats say, that we do what they tell us to do. And we forget that we actually have agency and choice, and we can question. And that's what really this podcast is about. I've titled it The Things You Can Decline During Your Pregnancy. And again, we're only going to get into a very short bit, but it's something that I hope spurs some conversation for you. And I hope that it spurs not only conversation with you and your partner, but also your care providers. And that gives you a glimpse, of your own agency. And this is really about also honoring what's true and real for you, honoring your instincts. And so what I'm saying, some of these things you might choose not to decline. And medically, you might need to actually accept maybe some of these things. Again, I'm not a medical professional. I'm a yoga therapist, I'm a yoga therapy practitioner. I'm a birth doula, childbirth educator. I'm not going to come in between you and your care provider, especially if there's medical attention that you need. And I also want to recognize that we have, again, so much more sovereignty and agency than we realize. And we don't necessarily need to do everything that is quote unquote expected of us. Maybe just let that sit while they take a sip of tea. We don't need to do everything that's expected of us. Maybe even beyond pregnancy and beyond birth and postpartum, right? Like that's a lesson into our lives. So, what are some things that you can decline during your pregnancy? A big one is weight checks. I know. Weight checks, like meaning that you're stepping on a scale every time you see your care provider. And I'm going to speak a lot of this from my own experience because it's the only way, and I don't have permission to share anybody else's journey but my own. And so I hope part of it is helpful for you. I declined weight checks for both of my pregnancies. One of them when I was in a more traditional medical model. They respected it. They didn't really want to do it at first, but they respected it. And then I had switched providers and it was fine. And then my whole last pregnancy, I didn't do one weight check. And there's a couple of reasons for this for me. I shared this, I believe, in episode 1, is that I had some very orthorexic tendencies, if you will, when I was experiencing my hypothalamic amenorrhea. Weight has also been kind of a triggering thing in my life in the past. I actually haven't stepped on a scale in years. I was a dancer for many, many years. And while actually I don't recall my teachers when I was younger, elementary, middle, high school, it was more in college. I don't remember them ever actually making it a thing. It was a thing. And I really want to get away from constantly measuring. So you can look at a pregnant being and see vitality and see health without having them step on a scale. Okay. And so many of the ways that we measure pregnancy isn't by actually looking and seeing the person in front of us. It's by looking at numbers on a chart, looking at a computer, typing things up. During birth, it's looking at, a transcript that shows you when the contractions are happening and how far apart they are. And we need to actually start to really get in touch with people again, not necessarily machines and devices. And so if weight is a trigger for you, you don't have to say that you want to be weighed. You can say, I decline. At the very least, you can turn around on a scale and say, I don't want you to shout the number out. And also for a lot of the people that I work with, it becomes this obsession of getting back down to a pre-pregnancy weight, which what the heck does that mean? What is and when and why? And we know that weight fluctuates at different parts of our cycle and different months and what we're moving through and how much muscle mass we have and what is the density in our body, all these things. So why does that even matter? Why can't we actually move it back to the way that we feel? And yes, I know that weight can be a way to monitor really drastic weight gain. Again, so can looking at a person. Okay. So can looking at a person. So can the way that your clothes fit. And again, I don't want to say that there is never a necessity for modern medicine. That's definitely not what I'm saying. I'm just saying you can decide if I want to be weighed or not. Another way that people might say it's important for you to know your weight or know about what you weigh is if you decide to have some sort of intervention in your birth. If you want pain medication or something of that nature, they might want to know what the dosage could be. And I'm not going to go further into that because that's really not my territory. It's something that I want to steer away from, but that could be a reason that they want to monitor weight. But just to say we want to know that you're gaining well, or that you're not gaining too much. Again, I think you can really look at an individual. Of course, there are definitely caveats to all of this. So again, please, I won't say that as much as I continue on, but that's something that I did do. I declined weight checks. And it was fine. Everything was fine. Everything was great. It actually helped me to not obsess, to really just love being in my body and to really love my prenatal visits. I didn't dread what was going to be measured there. Okay. So really fun, really fun. And, the other thing that I'm thinking about is if I don't know about OBGYN practitioners, but typically midwives will also measure the height of the fundus. So the height of the uterus as the belly is growing, particularly as you get into second, third trimesters. And that was really fun for me to actually see how my belly was growing. And they'll measure and make sure that your belly is growing in proportion to the weeks that you are pregnant. And that again is a really beautiful indicator of health, that your baby's growing, that you are gaining and growing in a way that is healthy for you and for that baby. So just a little aside. Okay, another thing that you can decline. Whoo, okay, here we go with controversial topics, right? Ultrasounds. In most pregnancies, you do not need ultrasounds. You don't need them. I actually asked my midwife about, I didn't actually ask. She told me that she doesn't really even recommend the viability scan, which is also a terrible word. Like, is my baby viable? Meaning that you would have an early ultrasound early in your pregnancy to determine if the baby is alive, essentially, or not. That you could do that via a blood test if you wanted. She did like a mid-pregnancy, like a 20-week ultrasound. I think I got mine at 25 weeks. And that was more so to see where the placenta was. She did like that. There are a lot of individuals who did not have one ultrasound during their entire pregnancy. And again, I won't go too much into what ultrasound technology was used for. It was not for pregnancy in the beginning. It wasn't to necessarily monitor our babies, and I can maybe drop some show notes, some books that you can look into. But there is we can say caution around ultrasound being actually good for the body and good for a baby. A lot of times you'll notice that a baby either stops moving or they try and move away from the ultrasound, and there's some speculation that it's really loud for them. There's some speculation into how safe the technology really is, especially as we increase into these like 3D, 4D technologies of looking at our babies. And again, I'm not saying like don't do them. There might be very good reasons. Some babies might have heart problems. Some babies might have lung problems or growth problems that we're trying to monitor. But again, I think that the problem begins to arise when we think that we can control the outcome of our baby's health by continued monitoring, especially when we don't know what the effects of all of those ultrasound technologies have on our babies and on our bodies. That is what I would love for you to do some research about, for you to look further into, and to see what lands for you, what feels right for you. I'm also thinking about many instances where ultrasound creates a lot of further worry for the mother, for the partner, for the family, meaning that they might find something on an ultrasound that they want to continue to monitor, but that may not be, I'm going into a little bit of my story too, but that may not actually be that concerning. Okay. What my providers and what other providers I've worked with say, there's always deviations of normal. And sometimes ultrasounds can create more anxiety around those deviations than there really need to be. There's always deviations in nature. That doesn't mean that it's unnatural or unhealthy. So if you're really attached to the idea of continued ultrasounds and continued monitoring of where baby is in your body and what they're doing, I invite you to play with, is that actually creating more friction, more anxiety? And is that actually taking me away from my own internal wisdom? Okay. Midwives, again, and some OBGYNs, I'm sure, they can palpate your belly and they can see, meaning they can touch your belly and they can see, one of my midwives actually taught Eugene, my husband, how to do this. They can see where baby is in the pelvis, if the head's head down, or the baby's head down rather, in the pelvis, where the bottom is, where the feet are. You can do some belly mapping, particularly towards the later part of your pregnancy when you're beginning to move towards labor and birth, to see where your baby is at. We don't need to necessarily rely all the time on these other technologies. So something fun that you may not have known, and maybe you could ask your midwife or your care provider to teach you where your baby is by learning how to palpate your belly safely. So kind of fun to play with. Another thing that you can decline is the glucose test for gestational diabetes. Yes, you can decline this. And I've done it twice. I have never taken or drank the glucola. It doesn't make sense to me when you see the ingredients that are in this drink. It just doesn't make sense to me, especially with the way that I live my life. And I'm guessing if you're here, you have a way of eating and breathing and being in the world that is really tied to health, right? Real health and well-being. And so it just didn't make sense to me. Does that mean that I didn't screen for gestational diabetes? No, that's not what that means. What I did, and this is where the difference is if you're choosing to decline some of these measures, you really have to create some more vigilance on your part. You have to actually participate in your own birth a bit more. That's very important. And so what I did is I got a glucometer and I pricked my finger 3 or 4 times a day for 2 weeks and measured my blood sugar. And then I took that document to both of my midwives for my first and second pregnancy, and we checked it to make sure that I didn't have gestational diabetes. And it was actually a really awesome science experiment, and this isn't expensive either. I think I went to the pharmacy and paid like $10 for my glucometer and the strips and, you know, but it was really interesting to see how certain foods affected my blood sugar, how my blood sugar kind of, and how I felt, just in general when I would measure what it was, my I think they call it fasting, my fasting blood sugar rate overnight. Like it was just really interesting to learn more about my body. And I really want to reiterate that if you're choosing to go these directions, and it's one of the reasons why I also chose to have home birth midwives, because I wanted more of an experience in my birth process. So, which means that you need to be standing up and saying certain things, but you also need to be doing and monitoring certain things. For example, for my blood work and for all like my lab tests, I had to go somewhere to do that. I didn't go to my office, my care provider's office or the hospital and have everything done there. I had to go to a lab and order certain tests and then send them back. And that's a different level of responsibility, but it also really teaches you a lot about your body and about your needs and about the process of giving birth, right? Of inviting life, and especially in terms of in modern medicine, what that looks like. Okay, and the last thing I'm going to talk about is what you can decline are vaginal checks and cervical checks. So, it's really interesting to me. My first pregnancy, I remember getting really close to my due date, as one does. And this isn't a date at which the baby should arrive because that's ridiculous. And I remember my neighbor across the street, who is definitely not listening to this, but who used to be a labor and delivery nurse, shouted in my neighborhood, like, "How dilated are you?" And I was like, okay, there's like people walking around. I had my baby in the summer. So there's people walking around. And I just was like, I don't know. Like, I don't know. It's not necessary. It's not necessary the closer that you get to your due date to have vaginal exams or cervical checks, because dilation actually means nothing. It doesn't matter if you're 1 centimeter, 2 centimeters, 3 centimeters. It doesn't mean that labor is imminent. It doesn't. And again, it's a way that we try and control an uncontrollable process. It's a way that we try and give our minds some ease of, oh, labor is on its way, or labor is not anywhere near, or whatever, instead of just kind of relaxing into, my baby's going to come when he or she comes, or my babies are going to come when they are ready to come. The only time I'll say maybe a cervical check is helpful is if you're really going further, if you're really like past 42 weeks. It might be something that the midwife wants to do to assess if labor is at all, getting close, and maybe even to see how far down baby is in the pelvis. But I definitely wouldn't say it's necessary, and you can always decline it, and you should always have consent. That's more so during your labor and birth experience. Nobody should have their hands inside of you without your consent. And again, during birth, you can turn down vaginal checks and cervical checks as often as you'd like. They're not necessary. And this is something, again, I would really highly recommend you talk with your care providers about, because I can't tell you how many women And birthing people I talk to who are shocked that people have not asked them if that's what they wanted, particularly in their births, and they're angry about it and upset and they feel violated, and they have every right to be. So you don't have to. You can decline them during your pregnancy and also during your birth. You can also accept them if that's really what you want. But again, it's not a sign that labor is imminent. Just because you're 2 centimeters dilated, you could be walking around that way for 2 weeks before labor comes on. And you also could dilate really quickly like that and be in labor. And whereas the day before you weren't dilated and barely effaced, you know? So just a couple of things to think about. There's certainly more you can decline, but I also want to share not only what you can decline, but what you can think about inviting. All right. What you can think about inviting. So the first one is when I was sharing about the woman on the beach who I was talking to earlier on in this episode. You can decide who announces the gender of your baby if you're waiting to find out. You know, if you're not doing anatomy scans, you're not doing those ultrasounds, and you want to keep it a surprise, you can say, I want my partner to announce the gender, or I would like to announce the gender. And these are very much birth intentions because we never know what's going to happen during birth. We can't predict completely the path, but we can set some of these intentions of like, this is what's really important to me. So can we hold that as true? So again, another sip of tea. So you can also decide even before that who's going to catch the baby. So contrary to maybe some popular language, your doctor, your midwife does not deliver your baby. You do that. They might catch your baby, but you deliver your baby. And depending on your provider, you might have a conversation if you want to catch your baby, which I did. If you want to do that, or if you want your partner, if your partner wants to catch your baby, they might say, hell no, but maybe that is of interest. And I think a lot of us don't realize that that is even an option, or we don't feel confident in that, you know, that curiosity or that desire. And so we just don't say anything. And this will probably depend on your care provider. So if that's something that's important to you, you might want to look into different care providers if yours isn't a go with that idea. But you can think about that. You can invite that. You know, I want to have more of a hands-off birth maybe, and I want my partner to have more of a role, or I want to have more of a role, or whatever it might be. So we said, say gender. We talked about catching the baby. You can also decide who cuts the cord. So if you're here, you might know that delayed cord clamping is the way to go, to wait until the cord stops pulsating completely before you cut the umbilical cord that connects you with your baby. And you might decide who gets to cut it. So maybe you don't want the nurse to do it or the provider to do it. Maybe your partner wants to do that. That's something that they would like to be involved with. So again, you can share that as an intention. You can share, yeah, of course, like delayed cord clamping and cutting. And this is, you know, something again that you can decline, but I think of it as more of an invitation of direct skin to skin right away with your baby. So even if you have a cesarean birth, there's a way that you can get some skin to skin with that baby pretty early on. And that means that your baby is not, you know, completely rubbed down. We keep the vernix on them, that white covering that keeps their skin nice and full of moisture and smooth. And that they're not wrapped in a swaddle and, you know, given a hat and given a passy and put on a warmer or weighed right away. No, you can decline all that and just ask for that baby to be skin to skin for as long as you want. Like, it's not necessary to weigh the baby right away. And that's something that you can totally invite. Skin to skin is really good to boost your hormones in terms of breastfeeding and lactation. It's really good to help regulate the nervous system of the baby, regulate their body temperature and their breathing. And it is probably one of the most beautiful moments that you can have, is that magical hour with your baby. And there's more after that. There's the breast crawl and the first latch and all of that. But those are some of the things that I want to offer you to start to think about in your journey, as like, I can decline certain things. I can invite certain things. I can set certain intentions. And along the way, as you're sharing some of these values and thoughts with your providers, if they are not open to it, You can change providers. You can decide that this isn't the right path for me, and you can do that at any point in your pregnancy. Okay. So I hope that's helpful for you. At the time of this podcast, I am opening Afterglow. Afterglow is open for enrollment. My perinatal mentorship program for pregnancy and for postpartum. And these are some of the topics that we talk about. We go into further depth of how you make your choices, about what you decline, what you invite, how you write your birth intentions, and also how you prepare and plan for your postpartum healing. And I actually think that there's more what we can do in terms of planning for postpartum. Well, there actually is more than we can do to plan for postpartum than we can actually plan for birth. Because even if you write a birth plan, that does not mean that that has happening. And more often it doesn't. But when we are writing our intentions for our birth, our values are coming through. And the things that are important to us are really brought to the forefront with an understanding that there's probably going to be a yielding and a surrendering to this process called birth. So we talk about this in Afterglow. And I would invite you to apply for it, to schedule some time to talk with me about it, if that's something that is of interest to you. And if I'm not enrolling for Afterglow right now, you can certainly look it up on our website and get on a wait list or just schedule time to talk to me about it. The beautiful thing about it is that this is really for full person health. So there are pre and postnatal yoga practices, there's practice libraries for these really important phases of life. They're safe, they're effective, they're supportive, they'll help your physical body. There's also videos and conversations just like this one, but we go a bit further in depth and do more homework around it to really give you an awareness of what's happening during the perinatal period. So you could say childbirth education, but it is so much more than just childbirth because we're also talking about pregnancy and postpartum. And then the piece that's really important for the spirit and for the emotions is connecting in community with a community of women and birthing people who get it, who are interested in having more conversations than, what stroller did you get, which is important. Yes, we need strollers. But we also need to talk about identity and healing and maybe redefining work and intentions and values and familial systems. Like all of those things are incredibly important and what we need to do to really create healthier babies, mothers, parents, societies, right? Whole communities. So if you're interested in Afterglow, I'd love to talk to you about it. And I'd love to hear from you. I'd love to know what resonates and maybe what other topics you might want to talk about on mother birth. We'll have a few more episodes in this season, and then I'll take a break and reevaluate and see what's next. So again, thank you for being here. Thank you for your time. Hope you have a beautiful, beautiful, beautiful rest of your day. Take care.